verified my doctor's orders and gathered my supplies. Knock, knock.
Come in.
For privacy, wash my hands. Hi, I'm Kara, I'm one of the student nurses at CF. Can you verify your name and date of birth for me?
John Smith, February 3rd, 1942.
Perfect, Mr. Smith. I verified with the doctor that you're going to receive gentamicin 80 milligrams via your IV every day. That's an IV antibiotic. So, is that okay? Do you have any questions or concerns?
No, I've had it before.
Okay, good. All right, so you have your central line here. Everything looks good. No signs of infection or anything. So I'm going to raise your bed up a little bit so it's better for both of us. And lower the side rail. Wash my hands. And come over to prepare my medication. So I have an order here to administer gentamicin, 80 milligrams IV daily. Medication bottle labeled 40 milligrams per ml. So I've reviewed in the Davis Drug Guide about the gentamicin. You can dilute with normal saline, so that's what I'll do. And it says 10 milligrams per ml. And since I need 80, I will need to dilute with 8 mLs of normal saline. So go ahead and obtain my vial. Perfect. Gentamicin, this will be my first check. Gentamicin, 40 milligrams per ml. I have 2 mLs in my vial, which will equal 80. And I need to give gentamicin 80 milligrams IV, so that's perfect. Now my second check, I will need to verify. I have 8 mLs of normal saline here in my syringe. And then I have a 2 ml vial with gentamicin 40 milligrams per ml, and I need to give 80. So I'm going to go ahead now and inject my 8 mLs of normal saline. Do that. I'll dilute it nice. Once I see that it's all diluted, I can go ahead and draw back the 10 So my third check, I'm going to be giving 80 milligrams IV gentamicin, and I have gentamicin 40 milligrams per ml, 2 mLs. I added 8 and drew back all 10 mLs from the syringe to equal the 80 milligrams. And I'm going to add this to a 100 ml bag of normal saline. Check for the clarity, make sure it's not cloudy at all. The expiration date is good, March of 2015, so that's perfect. And I'm going to go ahead and add my 10 mLs of medication that's already diluted into my 100 ml bag of normal saline. Just discard that in the sharps container, and I will relabel my medication on my IV with the correct date, time, initial, and medication. I'll label my bag. I have my IV tubing here. Go ahead and date and time my IV tubing. Nurse to come on. Okay, so now I can go ahead and spike my bag. Remove the cap. Prime my tubing. there's no air in the line after I prime my tubing. And so I have my 80 milligrams of gentamicin in my 100 ml bag. I'm going to administer this medication using the 6 rights: right patient, right dose, right medication, right route, right documentation, and right time. So now that I have that verified, I have a cap on the end of this. Go ahead and wash my hands and don my clean gloves that I would have here. Don my clean gloves. I'll take my syringe with my saline flush. Since I'm doing it in the central line, I will go ahead and flush with 10 mLs wearing my gloves. I'll clean my port site and flush with my 10 mLs of saline. Okay, now I flush. As part of that, I will clean my site again. Move my cap and attach to the patient here. And so I have my 100 ml bag, which is 110 with a 10 that I've added to it. So it'll be 110 mLs per hour because you can administer this over 30 to 60 minutes. So my tubing has a drop factor of 15. So I'll go ahead and be giving 27.5 drops per minute, which would be about 7 drops every 15 seconds. So I'll go ahead and time that here by gravity. Count my drops, make sure I'm giving about 7 every 15 seconds. Okay, perfect. Now that I've adjusted my IV, I'll go ahead and remove my gloves and wash my hands. And how are you feeling? Everything going okay?
I'm
Put my
fine.
call valve back in reach and adjust the bed to a low locked position. And wash my hands, leave the room, and do all of my documentation.